Good afternoon and welcome. I am Kayla Edwards from the Pulitzer Center. I'm glad you're joining us today for the second event in the 1619 Project Law School Initiative series. As we wait for more people to join us today, please let us know in the chat where you're listening from. Also, if you'd like to tweet with us today, we'll be using the hashtag 1619lawschools. For those of you who have not joined us before, the Pulitzer Center is a nonprofit journalism and education organization based in Washington, D.C. Our mission is to elevate public engagement with underreported issues through direct support of journalism and through education and outreach programs. We support more than 170 reporting projects each year on global and local issues. On our website at pulitzercenter.org, we bring together this work by theme, including racial justice, environment and climate change, migration, public health, and more. Our education programming spans elementary schools to graduate degree programs and outreach to the public. We've developed a strong university program connecting journalists with college campuses in person and now virtually to engage with students. We also award reporting fellowships every year to students from our now more than 35 university partners. Our conversation today is a continuation of outreach across the Pulitzer Center around a project that aligns with our education mission and goals. The 1619 Project commemorates the 400th anniversary of the historical moment when a ship arrived in Point Comfort, Virginia, carrying 20 to 30 enslaved Africans. It examines slavery's legacy by reframing the way we understand this history and by focusing on the contributions of Black people in the United States. You can explore the project online at pulitzercenter.org/1619, along with curricular resources developed by the Pulitzer Center as the education partner to the New York Times Magazine's 1619 Project. Today, we're continuing last week's conversation about our newest program, the 1619 Project Law School Initiative, a collaboration between the Pulitzer Center, Howard University, and the University of Miami Schools of Law. The initiative focuses on curricular resources crafted by law school students to introduce the 1619 Project and spark frank conversations in legal education about the legacy of slavery. The aim of this collaborative work is to make the case for an interdisciplinary approach to legal studies that draws upon journalism, history, and public discourse. Now, a few logistics as we begin. If you have questions for today's speakers, please use the Q&A icon on your screen. You can begin adding questions at any time throughout today's remarks. There's also a chat icon on your screen. We'd appreciate it if you'd use the chat box for technology-specific issues. Note that all attendees are muted, but if you can't hear us, please let us know via the chat box. We want to let you know we are recording today's session for those who could not join us today, and we'll also have a brief survey once our session ends. We'd love to know how we can improve our programming. Now, I'd like to introduce our first guest for today. John Oberdorfer is president of the Squire Patton Boggs Foundation, a DC nonprofit corporation affiliated with the international law firm Squire Patton Boggs, LLP. The foundation provides fellowships grants to law school students at 18 US law schools and a public policy institute in Belgium. John has led the foundation from its creation, and achievements under his leadership include the creation of a vibrant Dean's Circle that joins together deans from the fellowship law schools, 2 new sustained impact fellowship programs, and an active fellowship alumni program. The 1619 Project Law School Initiative is also a part of the Racial Justice Initiative by the Squire Patton Boggs Foundation and its Dean's Circle. John is a graduate of Dartmouth College and the Yale Law School. His professional career includes 41 years of practicing law at Patton Boggs, now Squire Patton Boggs, where he served on the firm's recruiting and management committees. John, we are so thankful that you're here with us today.
Thank you so much, Kaylee. It's great to be here, and thank you for the introduction. I'm pleased to be on this program with Linda Villarosa. It's very, very complimentary for me to be here with her. And I want to do a special shout out and thanks to Carmia and Marnie, who have been so instrumental in this project, which at last session, Carmia said that she was at the right place at the right time. And indeed she was. She was at a Dean Circle meeting of the foundation at the time that I came back from a visit with John and Kim Sawyer and reported that they were interested in a law school curriculum to go as part of the 1619 project. And Carmia and Marnie jumped in, and the rest is history. They've done a fabulous job, and I, on behalf of the foundation, want to salute them, salute the center, and salute the project. It's a great, great addition to law school education and going forth from there. I was on last week and was so impressed by the four students who talked about how they developed this program. And I think one of the geniuses of the program, and I attribute this to Marnie and Carmia, was using students, inviting students at their respective law schools to develop and write this curriculum. Because in the discussion last Wednesday, the students talked about why they were interested in doing so, and it was because they wanted to help shape the law school curriculum to meet what they saw were their objectives in terms of education, their objectives in the just in terms of the law, and their objectives in their law school careers, and to have a body of law presented that had a much broader spectrum than what they were currently experiencing. And the curricula that they have developed indeed is that, and provides a framework not only for students who want to be advocates in the public interest or whatever in that regard, but for all decision makers who are coming out of law school. There's a great exposure to a legacy that has not been really presented, certainly not as it has been since the 1619 project was inaugurated. So that's a tribute from us to the center and to Marnie and Carmia, and to, well, I understand there's some 20 or 25 students who worked on this with them. I'd like to take a moment, if I could, to talk about what underlies a lot of this, which is the rule of law. And in recent months, we have witnessed unbelievable attacks on the rule of law, and many questions about whether anyone is above the law and what that means. And our foundation on the 23rd of February had a forum, a dialogue among our fellows about the rule of law and what it means to them going forward. And it was quite moving to me, because there was some unexpected enlightening discussion about the rule of law. That the presumption had been, as the chairman of our board, Rodney Slater, and I had framed this discussion, that the rule of law was was the ultimate. It was on a pedestal, and how do we protect the rule of law? One law student, an African-American law student, said, well, you're focused on people who might be above the law, but the problem is that so much of the rule of law is used against people, primarily African-Americans and other minorities, and the law considers them to be below the law, beneath the law. And we need to focus on on that aspect of the rule of law, that it's often used badly. They're often, bad laws, and just saying that pursuit of the rule of law is a solution or a prescription doesn't take you far enough. And I think what he was saying, as I thought about it, the last week or 10 days, is in part what the 1619 curriculum teaches, which is to have a broad vision, but also to make sure that as we work through the curriculum, teach the curriculum, that the scales of justice accompany the rule of law. Thank you, Kayla.
Thank you, John, for those words and your ongoing leadership and commitment. It's a privilege to work with you, the Dean's Circle of the Squire Patton Boggs Foundation, and the Pulitzer Center in furtherance of social justice advocacy and inclusive and accurate education. It's my pleasure to introduce today's featured guests to our audience, Linda Villarosa, Emily Sanchez, and Rachel May. Linda Villarosa is an award-winning journalist, author, editor, novelist, and educator. She's a contributing writer for the New York Times Magazine, where she covers the intersection of health, medicine, race, inequality, and social justice. Most recently, she covered the toll COVID-19 has taken on Black communities in America and the environmental justice movement in Philadelphia. Ms. Villarosa has won numerous awards, including recognition from organizations such as the American Medical Writers Association, the Arthur Ashe Institute, the New York Association of Black Journalists, the National Women's Political Caucus, and the National Lesbian and Gay Journalists Association. A graduate of the University of Colorado, she also spent a year at the Harvard T.H. Chan School of Public Health as a journalism fellow and has a master's degree in urban journalism and digital storytelling from CUNY. She teaches reporting, writing, and Black studies at the City College of New York in Harlem. Her piece in the 1619 magazine highlights the way in which myths about racial differences have and continue to lead to inequality in access to and the delivery of healthcare services. She's joined today by two outstanding and dedicated students who formed our law student team, a collaboration, as John mentioned, of Howard and Miami law students working together to build out the educational model based on Ms. Villarosa's essential piece. Emily Sanchez is a third-year student at the University of Miami School of Law, where she continues to develop her passion for public health and policy. Born and raised in Miami, she holds undergraduate degrees in political science and criminal justice from FIU, Florida International University. She obtained her master's in public health at the University of Miami, specializing her studies in health policy and research. Currently, she's president of Miami Law's Health Law Association and is the student liaison for the American Bar Association's Health Law section. Rachel May is a third-year law student at Howard University and a former educator, I would say, continuing educator. Her work and contributions speak to that. After earning her bachelor's from the University of Michigan with a major in psychology and a minor in Afro-American studies, she moved to Miami, where she taught primary-aged kids through Teach for America. She then returned to her hometown of Washington, D.C. to teach kindergarten in a Title I charter school. In law school, Rachel has been an active member and leader in the Education Law Society and has focused her studies on youth justice, alternative dispute resolution, and family law. She looks forward to using her knowledge to continue to drive change in the educational arena and has done so already with her work. Thank you so much to our guests for making the time to share your work and your passion today. I'll now turn it over to the students. Thank you.
Thank you, Dean Lennon, and thank you, Ms. Villarosa, for being with us today. We will start off our discussion with our first question. Please describe your journey in authoring the public health piece for the 1619 project. What was the most impactful moment or most surprising moment for you in investigating and writing this piece?
Well, thank you for having me. I'm really excited to be here with the Pulitzer Center and the moderators. I hadn't heard your bios before. That's you're very amazing. And so I'm honored to share this moment with you. And thank you for that question. I am a contributing writer to the New York Times Magazine. So I basically, either write from my home in Brooklyn, where I am now, or am teaching at City College in Harlem. So I guess in early 2019, I got invited to a meeting at the Times Magazine where I'm a contributing writer, but I rarely go into the building. And I thought of saying no because I don't really like to go in, it's too stressful. But then when I heard Nicole Hannah-Jones was running the meeting, I realized that this was going to be important. I hadn't really heard of why 1619 was important yet, and it was soon to consume the rest of the year for me. At that first meeting, Nicole described how she thought of using the 1619 anniversary to write an essay in the magazine. Then the staff was so excited of the magazine that they said, oh, why don't you take the whole magazine? And then it kept growing, and it was like, why don't you take most of the newspaper? And so we were at the meeting to decide what would go in. And there were people from all kinds of fields. Mine was public health. And then our charge was to go back and think of what we wanted to write about, thinking of starting during enslavement, what is the through line to today? So all of us made the same mistake in our first drafts. We only wrote about the part that was the past. So what I was doing was looking at all of these terrible things that had happened during slavery to Black bodies, but it was something most of us already knew because we already knew of the horrors and cruelties of slavery. So basically, all of us were sent back to say, what is the through line to today? You have to pick an issue of the many cruelties that happen that still exist. So I took pain tolerance and lung function. And these were two that had a direct through line to today. The idea that Black people have a superhuman tolerance for pain began in enslavement as a way to show that slavery wasn't that terrible, and to continue torturing Black bodies. And it had the through line to today because I used a 2016 survey of medical students and residents that showed that half of them had believed at least one fallacy related to Black bodies that medical students, doctors to be, should not still believe. The idea that Black people don't have the same pain tolerance, that we have thicker skin, that we have different nerve endings, all of these, our blood coagulates differently, are myths left over from slavery that are still in the medical system today. The second one was lung function, and that was the idea that Black people had inferior lung function, and it made slavery made sense because it was a form of exercise and it was a way to build the lungs of Black people by working hard. It had a through line to today because there's an instrument that is used to measure lung function called the spirometer, and that has a race correction that still believes the myth that Black people have inferior lung function. So that is, that was my essay. And I think the thing that was the most surprising was that these myths in the past were not just floating around in the universe of the past. It was that they were pushed by doctors and scientists. They were written in medical journals, presented as fact by doctors who were trying to justify enslavement and the cruelties that went with it, and that it was legitimized by people who were in the medical field and in the scientific arena.
Ms. Villarosa, given what you just told us about those through lines and how that history carries through to today, we want to talk a little bit about the recent call that we've heard to declare racism a public health crisis in states and other localities. We've seen that these health disparities have kind of grown and been highlighted during the COVID-19 pandemic. So we're wondering, how do you think the legacy of the American healthcare system has shaped outcomes for Black Americans in this era?
Well, I think the COVID-19 has proven everything that we were saying that Janine Interlandi and I were the two that wrote about public health, that we were saying in our essays, is that there are these disparities in the healthcare system and in society that lower the health outcomes of African Americans and have for centuries. And I think I'm just going to offer one example, and that's the example of Dr. Susan Moore. So in December, she posted on her Facebook page a picture of herself in the hospital with tubes in her nose, and it was a cry for help. She's a physician in Indianapolis who had contracted COVID, probably through her work, and she went to the hospital and she was given such poor health care, including denied pain medication because under the idea that she was drug seeking. She was a physician, but she was accused of being drug seeking. So she posted the Facebook page post video out of desperation to try to get the care that she needed. She ended up being discharged from the hospital and died at the, not long after she was discharged from the hospital. And so if there's still the belief that Black people have a different kind of sort of pain tolerance. And if there's the idea that we're drug seeking when we're in legitimate pain and that our pain is not, there's no empathy for our pain, and that a doctor cannot get proper health care in the system that she works in, something's clearly still wrong with the system that, I hate when people become these kinds of examples, but that's exactly what happened.
Thank you. I remember that story. It's tragic. But third question. With all of this call to prioritize health equity in the current moment, especially health equity in public health, there are certain aspects of public health similar to the social determinants of health that obviously are large factors to health quality. Which one, are there any key areas that you would identify for maybe systemic change?
I think the easiest thing to do is to make sure that everyone has the health care that they need and deserve. I mean, that is a thing that could actually happen if there's the political will. And maybe that will should come right now when you see people who are not, COVID is again showing what happens when people don't have the health care that they need. And that's, one thing it showed. I think, the harder question is the question of racism that runs through the institutions of our society. And so, that there is a clear link, a scientific link between how people are treated, and people of color mainly are treated in society, and the effect on health. And it comes with, from birth in infant mortality rates to death with life expectancy. And so that, again, it's a big tackle, a big ask, but I think we have to continue to call out problems in our society that lead to poor health. And I think the other thing that is doable, it's hard, but doable, is the environment. And so when I was writing my piece about COVID and Black bodies in I guess that was April, a study came out from Harvard, and it was really so perfect for my work, which often intersects the environment and other kinds of health issues. And it showed that people who are subject to air pollution have worse COVID outcomes. So are more likely to be hospitalized and more likely to die if they're breathing dirty air. And Black people are 75% more likely, even across class lines, to live in a community that's polluted by air pollution and other problems. And so that intersection right there, obviously on its own, environmental justice is important, but also the intersection with other health issues is also important to understand.
Emily and I had the opportunity to talk a little bit the other day about this topic, and we talked about how the workforce, the healthcare workforce, is particularly a space where there might be room for growth in health equity. We're wondering what should public health officials, legal professionals, activists, change makers, what should they be focusing on prioritizing within the healthcare system if they really want to make a big difference?
Again, healthcare for all is just the one that should happen. I think the other thing that should happen is to diversify the workforce, and to diversify the workforce kind of beginning at the top rather than beginning at the bottom. I mean, it has to have, I don't mean bottom isn't not a nice way to say about medical providers of the future, but to make sure it's diverse, because some of these, if you look at some of the inequality in the healthcare system, it comes from providers who are different from the patients they serve. And as our United States becomes more and more diverse, it's important that the healthcare system also becomes more and more diverse. At this point, only 5% of doctors are Black, and only, I think it's 11% of physicians are people of color at all. So, you know, that is very undiverse given where the country's going. So that is kind of between, you know, getting healthcare for everyone and making a more diverse healthcare system. I think those are two things that should be addressed immediately.
Thank you. And, you know, having a provider that is of the same ethnic background makes a huge difference in health outcomes. So that is a great point, as well as being in those positions to make really important decisions on other people's health as well. So moving on to our next question. Often many students do not learn about the historical intersection of race and health unless they actively seek the information through special programs and graduate school. How can we continue to advocate for more education on these issues, as they are often absent from traditional models of education and professional development?
I think that what the Pulitzer Center is doing with the 1619 curriculum is a really good start. I was thinking about it because when I was growing up, way back in the day, I learned about slavery through Roots because we didn't have anything offered at all. And I remember, you know, just watching it with my family going, wait, Mom, Dad, did this really happen? And then I thought, well, that was a long time ago. But my children, I went to their field trip to Gettysburg. I think it was my daughter, I don't remember which of the kids, field trip to Gettysburg. And so then I was on the bus. It's like, oh, okay, the battles of Gettysburg, very important in the North. So I sat next to the teacher on the way back and I said, oh, this is an interesting start to the beginning of how you're teaching the children about slavery. What is, and you know, speaking about the Civil War, what is the rest of it? And she said, oh, that's it. And so I thought, how could in 2 generations of my lifetime, this still be happening where there's not a robust, you know, learning about such an important issue in the history of our country. And so I think what's happening now is really important. I think continuing to broaden that out is also important, and certainly a change of administration will help. I mean, at the end of last year, there was a push to ban the 1619 Project in schools. There was a push to create a 1776 commission, which is absurd. And so it's good that things are changing, but I think we cannot let our guard down, and we cannot, you know, look away and think, oh, the work is done, because it's very important that young people get this information and get a rich look at our history. Sometimes when we push for this 1619, you know, this project, I hear, oh, you're critiquing the country because you hate it. And what I love about the project is it pointed out that the story of Blacks in America is a story of tragedy, but also triumph. It also, Nicole's opening essay talks about the idea that we are the Americans that care most about democracy because we were denied it and have continued to fight for it. And I think that's an important framework for us to have, and for, you know, us to lift up and amplify, because it speaks to the idea that we care about this country so deeply. That's why we want to understand the full picture.
As students, as law students specifically, our goal was in building out this curriculum, some of us talked about the idea of having the opportunity to provide legal educators and other students the opportunity to enhance their professional competency, expand their knowledge base and their contextual framework. I'm wondering if you see any opportunities for future attorneys like Emily and myself who have engaged with this curriculum and who have had a chance to kind of roll over the material. How do you think we can work to contribute to the betterment of public health in this country?
I am so glad you asked me that question, because I have something super specific. So there is this group in California, they're medical students, they're medical students and public health students. And so last year they got really, a bunch of them in 1 year took a class about sort of the ideas behind the 1619 Project. So it wasn't related to that, but it was about the ideas and about medicine and about sort of racial injustice in medicine. And so they got so fired up that they started this organization called the Center for Healing and Justice in Medicine. So they are really amazing. I interviewed some of it launched in May of 2020 online. There right away, there were 7,000 views of their information, mainly from other medical students. And what I like about them is they did everything completely DIY. So I said to them, oh, how did you get the money to start this? Did you have money? Because they created this manifesto that is like, I mean, I'm writing a book about this, and their manifesto is so good. I'm like, oh, maybe I shouldn't write my book. Just use this. And they're so smart. They are also going to school at the same time. They got some tiny amount of money from the college. And I was like, wait, you all did this. You launched this on your own. You sort of didn't have any support from the college. 7,000 people have already seen it. This manifesto could be a book. And the other thing is they had a mailing address. So I was like, do you have an office? And they're like, oh, embarrassed, because it was like their student lounge or something was the address. So I think it might be interesting for these students who continue to do the work in the medical realm to look at what the intersection is with law, because some of the things that they're asking for and they're questioning could be solved through legislation, or could maybe be solved through legal issues. So I'm very interested in that. One of the things that they looked at this lung function issue and they break it down really well. And some, that is a question. Why is that still being taught in medical school? Why is it still baked into this machine that is supposed to measure current lung function? Why is there a race correction? So there's some questions and ideas, I think, that are in the air right now. And I see it in medical schools pushing back against the curriculum, pushing back against some of these old ideas that I find really exciting.
Thank you. And we have some audience questions. So I'm going to begin with our first audience question from Carolina. Please discuss what can be done to build trust between communities of color and the health workforce. What do health systems need to change about the way they do business?
That's a great question. And I have another really specific answer, because I'm doing all this research while writing my book. And so I'm seeing things that kind of are interesting at work. So I was in New Orleans for a year writing about maternal and infant mortality in 2018. So I spent a lot of time looking at the healthcare system, specifically OBGYN care in New Orleans. And I called out the city. I saw a woman being treated really badly during birth. I wrote about it. I engaged a lot, but then I left. So I went back last year to ask what is being done. So the two hospitals where my person that I was following received the worst care have both undergone anti-racism training, but then they took it up a notch and they made it restorative justice. They took it through a restorative justice lens. And so they made a lot of people in their hospital systems go through anti-racism, implicit bias training. But then they also asked people who had a bad experience in OBGYN at the various facilities to come speak to the providers, that many of them who were in the room when they received poor care. I saw something change when they had to listen to how people talked about the ways they were treated. And it was really intense. And you saw a change, you saw something happen. At one of the hospitals, they didn't have OBGYN providers in the ER, and they changed that because of what they heard from people from the community's lived experience. And I thought that was profound. And, I've seen some of that, not everywhere, but I've seen it go on in other places around the country. And I think it's important and it's a good model.
So with that in mind, I think talking about the kind of trust between healthcare and the public, I want to kind of shift the focus to the trust between journalism and the public, especially as someone who writes about healthcare. Can you talk a little bit about where we've been recently and how we can kind of repair some of the harm that's happened over the last few years?
Oh my goodness. I teach race and media. And so I taught yesterday the class about fake news. And, I describe what it is. Fake news is, this phenomenon that began, in 2016 to get called fake news because Russians were infiltrating our election. And then fake news is, this other situation that we had in 2016 and 2020, where it was on social media and, there were just articles and posts that were not real. And then it's like when a politician doesn't like what you say, they call your news fake. So it is really hard to build that trust back. It is hard when a lot of people get their information from social media. I am, really have changed the way I teach to put a fine point on news and media literacy and how to say the difference between what's real and what's not. I also try to, I don't really like to teach huge classes, but I've expanded my class because I really want this information to get out there. And it's very important, I think, to teach people how to understand the media more and to how to understand and dissect what's real and what's not, what's opinion, what's news. My friends from high school, that I see only at our high school reunions, called me and said, can you help us understand this? And I was surprised because, not all of them believe in the same politics I do, but they were saying, we don't understand how to consume the media that we come into contact with. And so I think that there is a hunger for this and there is a need for it.
I think we've got another audience question where someone wants to talk a little bit about global health policies and the ways that they might be tied to American slavery and colonialism, how those threads might exist in a larger context globally.
I'm gonna tell you something about myself. I am strictly stuck in the American system, and that the only thing I will say is it's more of a solution thing. So in my stories, I notice there's often a hero. There's someone who is helping other people navigate their medical issues or the system. It could be a doula, it could be a patient navigator, but it's a person that we would call a community health worker. And so in the United States, we have community health workers, but they're poorly paid, disorganized. We don't have enough of them. Some of them are just made to volunteer, where in many countries that have much, less expensive healthcare systems, less technologically focused, they have huge armies of community health workers who are chosen by communities, trained, and then sent back to the communities they're from to help navigate, to put together whatever clinical and technical innovations that they have or the system that they have with real people on the ground. And I think, we often go to foreign countries or go abroad to say, oh, let's share what we have abroad. We need to make that two-way and learn how other countries are working a system and admit that though our system is the most expensive in the world and perhaps the most sophisticated, that we often don't have enough care in our actual medical care system.
Thank you. And our last question is, how would you like to see the 1619 project expanded and included into future racial theory work? How can we better continue to educate and promote racial theory to improve Black lives and the lives of other marginalized groups?
I think just sticking with it, just teaching it, just lifting it up and just, starting young and keep doing it. It's interesting because I was thinking, I love doing this kind of thing, but I'm actually supposed to be writing a book. And same with Nicole. Nicole Hannah-Jones is a very busy person. We just sold the project to, as a book. And so we're all scrambling to rewrite our essays to be book chapters. And then that got bought by Oprah. So it's going to be seen widely. But, and Wesley Morris, who wrote about music, I was thinking about him. We were just talking, we're both really behind on our books. And he does the still processing podcast. So this guy is really busy. So we're really busy. So we have to figure out how to almost, make this go without us in a way, and just make it so that it's standardized, make it so that it is part of, the educational system. And, I love events like this, but it should just be uniform. It should be, just blended into the current system we have, and just make it so that everyone has access to it. And, I'm really appreciative to this curriculum. It's really important. And, I really respect the work that you did. I want to also say that one of the most moving parts of the 1619 project was the part about Howard Law students. And so that was a part that looked at how a group of Howard Law students and traced their ancestry back to their enslaved ancestors. And, it kind of, Nicole's opening essay to that said, they are our ancestors' wildest dreams. And that was so important. I didn't see that until I actually opened up the magazine on my doorstep when it came to my house, and I was crying because I just thought it was really important to say that there, we have these negative through lines. There's also positive through lines.
Absolutely. I actually remember seeing the article as well and saying, hey, I know that girl, getting very excited about it for a lot of the same reasons. We actually did get a couple of more audience questions. So before we wrap, I'll ask, what are the implications for the state of people of color in healthcare if we do dispel the narrative that universal healthcare burdens white people? What can we do in our communities today to help that shift?
I have a really interesting example that makes me very happy. So in Philadelphia, where I was reporting on environmental justice in this community called Gray's Ferry, I saw right away, it's really near this terrible refinery, used to be the largest on the Eastern Seaboard, and the COVID cases were very high in that community. And so, but even though it's near University City, there was not enough testing in the community. So even though the rates were high, they were probably falsely not even high enough because people weren't getting tested. So there was this group of Black physicians led by one who just said, I'm going to go to the Black communities where there's a lack of testing facilities and just do it myself. So I think her mother bought her a minivan or something. So she tricked out the minivan so that it was, they could do testing on street corners. And she got her doctor friends and soon many, many doctors to do testing in Philadelphia and Black communities. I think that it's not our responsibility to save ourselves. And I don't like that idea that we are our own, we're our brother's keeper and all that stuff. I think that this is an American problem. This is a problem that, the state of health in Black communities is everyone's issue, not just Black people. And we shouldn't have to do this ourselves. However, I like the model of doing it ourselves and then having others pick it up around the country and in other communities. And I think, this is not how things should be, but I do get cheered when, people want to make a difference in their lives and in the lives of the people that they love.
Well, we have another question. And how do you see the relationship between your work now and education? Have you always seen that connection, or is it something more recent? How has the 1619 influenced now your current work?
I think, well, I am an educator by accident. I was a freelance writer, and that is a really terrible way to get health insurance, by being a freelance writer. So when I got offered a job in academia, I'm at the City College of New York, the CUNY system, I jumped at that because I needed healthcare. And so I've been doing that for 10 years, and I teach Black studies. But I have taken a much deeper look. I don't assume that even Black studies students understand critical race theory. And what I saw when I first started teaching Black studies was my students of color, which are almost all of them, blaming themselves and their families and their communities for the problems of the community. And so the 1619 project has helped me have a grounding for teaching them that this is not something we are doing wrong. If there are problems in, the African Americans in our country, It is not because we are doing something wrong. It is not our fault. It is not because something is genetically wrong with our bodies. And that's why I like the idea of racism as a public health threat, because the idea used to be race is somehow a public health issue, and race is a risk factor for ill health. But behind that meant, oh, it's something wrong with you or something you're doing wrong. So the idea that it's not race, but racism speaks to the reality that something is wrong with our society, not us, and something is wrong with all the systems and institutions, including healthcare, that needs to be repaired.
So I've got one more question I'd like to add. Um, what do you think are the markers of that positive progress? What are the things that you're looking for to say, okay, now we're moving in the right direction. Now we're seeing the change that we've been talking about.
Hmm. All right. In California, so California, like the state, like all the other states, has had a problem with maternal mortality. So women were, the rates had been going up. So they started looking at this in about 2006. And so what they did was to say, we will figure this out. We are going to have the best technology in the hospitals of California to fight maternal mortality. We are not going to have women die in childbirth. They also had the same racial gap that we have in the country. So Black women are 3 to 4 times more likely to die or almost die in childbirth, even the most educated. So something was wrong in that state as it is in the country. So they tackled this problem through hospitals. So they said every hospital should have the same protocols when there's a crisis. So if someone's hemorrhaging, all the tools should be ready. Everyone should have a checklist of things to do. If someone requires an emergency C-section, all that should be done. And so they put all these protocols in place, and then they did great. They tested it. So between 2006 and 2013, they looked at what would happen if you fixed all the problems in hospitals in labor and delivery, and it worked. So, but in that time, the number of women who died in childbirth in the state of California dropped by 50%. What did not change was the racial gap. So still, Black women were 3 to 4 times more likely to die or almost die. And the biggest rise was in white women. So that's where, the biggest drop was in white women. So that's where you saw the change. So what the state of California did was come to the conclusion that we can't doctor our way out of this mess. We have to do something about racism in the system. So now, beginning last year, every provider who works with a pregnant woman, delivers a baby, has to go through implicit bias or anti-racism training in the state by law. So I think that is an interesting marker. So I am looking at the state of California. It just went into effect. But if that changes, then you can see that something worked. The other thing is there's new legislation. It's kind of old legislation that's been sort of pulled into one act called the Maternal Health Momnibus Act. And it's Lauren Underwood, the Congresswoman, and Cory Booker in the Senate. And that is something that if that gets passed, that will mean changes around maternal and probably infant mortality if it works. So we have to test these things out to see if they work. But now we have an experiment in California. So I'm really paying attention to that.
Absolutely. Maternal mortality is an issue that, when aligned for all other factors, race is still a determining factor for the disparity. And so we wanted to ask now our actual last question. What do you see now your work looking like? What is on the horizon?
Oh, thank you for that. I am finishing a book called Under the Skin, Race, Inequality, and the Health of a Nation. See how I'm all about America, the health of this nation. And for now, and so I'm just in the revision stages of that. Hopefully, it's a year late because I got off track with the 1619 with COVID, like so many other people, but that should come out early next year. So I'm super happy about that. I'm working on a story right now. It's just in the nascent stages And it looks at Chicago has the worst inequality in the country. So one part of Chicago has people live to age 90, and the part where my mother grew up, people live to age 60, and they're 9 miles apart. And so I am looking at tracing our family back and looking at sort of that life expectancy gap through the eyes of my family. My mother's super excited about that. So wish me luck working with my mother, traveling with my mother. So she's fun, but she is 90. And so she lives in New York. So she's sort of, gotten beyond the life expectancy of the community where she grew up. And so we're very interested in looking back to see what are the root causes.
Ms. Villarosa, thank you so much for being here and joining this conversation with us today. It's been illuminating, to say the least. I'm going to go ahead now and I'm going to pass things over to Dean Caesar from Howard Law.
Thank you, Rachel. Thank you, Emily, and thank you, Professor Villarosa. This was such an illuminating conversation. Something that we know as lawyers is that you get good answers when you ask good questions. And so this panel was just a testament to how much work Emily, Rachel, and all of the students who were part of this effort from University of Miami and from Howard University School of Law, how much work they put into developing the law school modules. And Professor Villarosa, so illuminating as an audience member to listen to you and to hear truth spoken into what may have been thought of as myth or paranoia or conspiracy theory in earlier parts of my life. And so I'm super excited for the book. Best of luck with traveling with your mom. I would also like to thank the Pulitzer Center once again, and Squire Patton Boggs, the Dean Circle. My colleague, Marnie Lennon, and I are just grateful to have been entrusted with the important work of this project. This is our first author presentation, and I'm so excited additionally for the presentations to follow. And so I would ask our attendees to stay tuned as Kayla gives more details on how you can be involved. And I encourage you all to share the recording of this session so that anyone who couldn't make it today can hear this amazing conversation when they have time.
Thank you. We are so thankful to journalist Linda Villarosa for today's conversation. Thanks also to my colleagues at the Pulitzer Center, especially Holly Peipenberg, our producer for today's session. I'm also grateful to John Oberdorfer, president of the Squire Patton Boggs Foundation, and Rodney Slater, the foundation's board chair. All of the law students and faculty at the University of Miami and Howard University Law Schools who contribute their time and skills to craft these modules. And thanks to you, our audience. We appreciate you for joining us today and for your questions. And for those who are able, please remember the Pulitzer Center is a nonprofit organization, so we depend on donor support. Please stay with us for just a few minutes longer to take a brief survey after we officially end today's session. And as a reminder, our next event in the series on the 1619 Project Law School Initiative will be next week, Wednesday, March 10th, where we will focus on law and politics. We will be joined by journalist Nicole Hannah-Jones, the Pulitzer Prize winning creator of the 1619 Project. So please visit our website for more details on that coming event. Register. I'm so looking forward to seeing you all there. Share with friends and colleagues. Thank you for being with us today. I hope you'll join again soon. Goodbye for now.